in West, I think everywhere depression is number one. And depression is the way you look at life. What is depression? When you suddenly lose joy in life. Again here, we don't see depression like the conventional doctors. I'm also a psychiatrist, so I don't see it as just some chemical disturbances in the brain. But it is my overall approach towards life, and things when don't go in the way they are, then I feel depressed. So depression again is not the illness. I think depression is one of the symptoms of the lifestyle and the perception of the person about his life which makes him depressed. So that we go into. But I agree with you, depression is one of the main illnesses. And in fact, there are many cases where you have physical pathology, but I believe underlying there is a lot of depression and other mental disorders. In homeopathy, we don't have super specialization. We don't have a cardiologist. We don't have a nephrologist. Homeopathy basically treats a person. And whole homeopathy is individualizing a case, finding the peculiarity of a patient and treating him. So what happens is when the person comes in depression, generally the psychiatrist or the conventional doctor would say it is endogenous. Endogenous depression means it is coming from inside and has no external reason. And when we ask them what is the internal reason, they'll say there is some chemical imbalances in the brain. It is almost like talking about some computer, some chip has gone wrong somewhere and we are treating it. But in homeopathy, we do not believe that there is a chemical imbalance in the brain. There is, but it is not the primary cause. It is the last in the sequence of all the things which are happening inside. So basically there is a lot of inner disturbances in his vitality, in his way of looking into life, his approach to life, which because of it, he gets into conflicts with other situations outside. Stress is not because of outside. I'll say I'm stressed because of heavy pressure of work. I will say that I'm getting very stressed in life because I have got some life circumstances. I have got a sick child. My wife is not doing well with me. But everybody in similar situations don't get stressed. The stress is because how I perceive the situation. And what they call endogenous, we don't believe is only just a chemical imbalance. We are not just bundle of nerves and chemicals. But I believe it is how you see life. And when you go into it and see, we all have one particular sensitivity, one particular program inside us. We are all programmed, unfortunately, if you want to say that way. The way we see life. Somebody feels I'm being persecuted, somebody is after me. Somebody feels something else, that I am all the time neglected. Now these type of perceptions or complexes which we live in generally put us in conflict with life situations. There is something in life and somebody neglects me, I will immediately react to it and get depressed that nobody loves me. Whereas other person in that same situation will say, oh, so what if he neglects me? There's no problem. So you see, it is all inside. So when we say it's endogenous, it is endogenous, but that endogenous is not something unknown cause. There is a cause which, if you see it from a homeopathic point of view, you have complete understanding why it is happening. But when you see it only in terms of depression and the biology and the brain, then it is an unknown cause. So depression is again very individualized in a person coming from his own inner state of being. Our own sensitivities which are in conflict with the world outside. Results are amazing. Very good results. But the science is difficult. So what happens is, it is not like conventional. Let's say somebody comes to me. I'm also a psychiatrist, as I told you, and if somebody comes and tells me I have loss of interest, no enthusiasm, I get up in the morning, I don't feel like going to work, I've lost my weight, I've lost my appetite, I don't sleep well. I say, okay, you are an antidepressant, you are depressed, okay, take Prozac, take an antidepressant and go. Second patient comes, similar story, I give Prozac and go. Right? This is not the case in homeopathy. We try to find out what is his depression, try to go into his life, even into his childhood, into his dreams, into his interest hobbies, into his even craving for food, crazy things, everything we go and then get a complete, we map the person in totality and then see in this individual what is the reason for his depression and then we treat. So what happens is, because it is such a difficult science. It is not even a science, I would say it's science plus arts. It requires a lot of skills. So sometimes you might have failures, but the failures are not because the science is wrong, but sometimes because the difficulty in doing this art. So sometimes I would advise patients who know homeopathy, they go first of all with half mind. They say, oh, I took those pills, those small pills, and it took 2-3 times and it didn't work. Because they have been trained to quick fixes. So what happens is, once you take and doesn't help, it goes away. But you know that in psychotherapy, people go for years and years and years and years. Sometimes if you don't get result, you meet the doctor again, homeopath again, meet them again. I'm sure in a few times they will find a remedy which will take the depression out of their system once and for all. The whole psychiatry began with psychotherapy, psychoanalysis, Freud, trying to understand the psyche of the person. Then what happened is, it was time consuming, lot of years to go through that psychotherapy and psychoanalysis. And finally, they could not take the patient deep enough. And after they took also, most of the time they could not give result. So out of frustration, they went into more chemicals and biological treatment. Because at least you give quick results, the person stands up and starts going. Of course, with all the side effects and with the possibility that he will have to take the medicine all his life. But homeopathy is a beautiful marriage between these two. It is almost like psychoanalysis, psychotherapy, and then we have some pills which take care. So the whole onus of improvement is not on the patient. Our pills take. Now what happens is, in psychotherapy, sometimes the patient comes and I have an understanding of the patient. Even if I am wrong, I will tell the patient, this is your problem, this is your problem. And if he doesn't improve, the guilt on him. Oh, see, I know my problem, but I am not improving. In homeopathy, the advantage is, I have an understanding of the patient and I give the remedy. If after 1 month patient does not improve, then I have to tell myself, why didn't he improve? That means my understanding is wrong. I have a chance to correct myself and a chance again to correct myself till I get to the exact, and then the result is there. So success rate depends also on the skill of the person. I think most of them, in most cases, give good results, but sometimes in difficult cases, you require a little bit more skill. But with the right remedy, believe me, patients improve. But I believe it changes the life, it changes the way of outlook. He'll be not only out of depression, but his whole outlook towards life will change, which he had never had before. I think it is a big step towards health. One dimension of health which we don't take care of in conventional medicine is a sense of well-being. I have patients who come with, let's say, knee joint, just an example. And when you treat the patient, after 2 months they'll say, doctor, my knee joint is alright, but suddenly I'm sleeping well. And I don't know, I used to have so many problems with my wife, but now I don't care. I can just let go and I don't take it into heart. Now I was treating the knee, but what happened to his mind? So we talk about clinical depression. Depression is a common thing. We all get depressed. Today I don't get my work done, I am depressed. But only when it goes beyond a certain level, we call it clinical depression. But in subtle levels, we all have our lows, and pretty many lows. And sometimes we are so emotionally labile, we have many lows, many times in a day. All these also are taken care of by homeopathy.